All right, we'll have more on the situation with our hospitals straight ahead. Dr. Sapphire will join us. But first, new reaction tonight to President Trump's handling of COVID-19 from prominent Democrats coast to coast.
I've been consistent. When we are working well together, I express it. When we're not, I'll express it. And I have nothing to say to create a wedge, because I would be lying to you. I'd be making something up to fulfill some political lane or some political purpose. And I'm not here to solve for politics. I'm here to solve for public safety and public health.
Look, I accept the notion of travel bans in this environment. So I disagree with President Trump on many things, but I actually think the travel ban piece of his strategy has been, in many ways, warranted.
Joining us now, Texas Lieutenant Governor Dan Patrick, a Republican. Good to have you with us again tonight, sir.
Great to be with you, Shannon, and chair of the Texas campaign in Texas. Also proud to have that.
Yes, you are. Okay, so let's talk about preparedness there in Texas. You guys have dealt with some very serious stuff in the past. How do you feel about this projection about hospital beds? Texas is a huge state, a lot of people. Are you guys ready?
Texas, Shannon, is always ready. And Governor Abbott and our team here in Texas, we are ahead of the curve. And I want to say something about the president. We'll never know how many lives, thousands, maybe millions of lives, literally, that he will have saved by taking the action he took on China, taking the action on the travel ban. And Shannon, what is very important that people are overseeing and overlooking, rather, is he put together a coalition of business leaders, whether they own an NBA team or they own a concert venue or they're putting on a rodeo. He was able to gather business leaders because he talks their language and his team and convince them to do what Italy didn't do and that no other country has done. And that's begin to shut down these big events so that the virus cannot spread and peak to a point that is going to create the crisis that you've been talking about in the beginning of the show. The whole point of shutting down every venue, I mean, think of it. There's not going to be a ball game live on television. Many schools are closing. We closed down the rodeo that has 70,000 people a night for the next 12 nights. And the reason for that, Shannon, is we cannot have a peak of this virus hitting hundreds of thousands or millions of people at one time. That would create a problem for our medical situation everywhere. What we're trying to do, think of it this way, Shannon, if 10,000 people broke their leg at one time, not even the finest hospital centers in the world could set every leg at one moment. What we don't want is to have millions of people come in for a test at the same time. So by closing down all of these events, which no one else has done in the world, we want to spread this out over the long period. So as our people receive the virus, we're able to handle it in a way that I know we will in Texas and I believe we will in America.
Yeah, and people who have nothing related to coronavirus, as you said, if it's a heart attack or a broken leg or something else, we got to make sure there's space for those folks too. The Fort Worth Star-Telegram says this: Texas has more than 10 million workers over 18, and according to research by the Institute for Women's Policy Research, 40% of them, some 4 million people, lack paid sick leave. The share of people without it is higher for service industry employees, about 75%, and Hispanics, 50%. How worried are you about that potential impact there in Texas?
Well, I'm not worried. I used to own restaurants, and I've been in the service business a long time ago. And we do have a lot of people that I'm concerned about who live on tips. In fact, when I was at a restaurant today, I actually tipped more because I could tell there were fewer people in the restaurant. People should think about doing that and take care of those folks who live on tips. But we will adjust to that. The president will have an economic plan. We will have a plan in Texas. But Shannon, one of the questions that I get asked by everyone is, why did we close down all of these events? You know, why suddenly, at a snap of a finger, did we just stop everything? And it goes back to, I think, which is going to be the most important thing for us, is flattening out this curve. Shannon, let's just say, and none of us know, but let's say that we're at 60% of our population. That's 200 million people potentially over the next 12 to 18 months who could be carriers of the virus. And of that amount, 80% will have little symptoms, won't need any hospital attention, but 15% will. And 5% right now, 3 to 5 to 7%, may end up in very critical condition. So you can see that these numbers in America, if we're at the 60 or 70% that Italy and Germany is in and other countries will be, that it's a significant issue for us. And that's why what we have done so far, and I applaud all the businesses, it's going to cost the businesses who are shutting down right now billions of dollars, billions. But they've done this because they understand what's at hand. And America is leading the way on how to handle this threat that, quite frankly, none of us have seen in our lifetime. So it doesn't mean we've done it perfectly, but we are way ahead of the curve in America. So far, we've had over 1,200 cases. We have about 36 to 40 deaths in America. In Texas, we have 23 cases. It's going to grow. People have to understand, Shannon, when you go out, and I've canceled most of my events, I've canceled all my fundraising, I'm doing what I need to do to help people be calm and also get the help they need. But people have to understand that wherever they go in America over the next 12 to 18 months, in the next 30 days, they're likely, if they're in a crowd, to be with people who have the virus. Doesn't mean those people are going to die or have to go to the hospital, but they may transmit that to you. Your grandkids at school may give it to you if you're a grandparent, or a senior citizen may, someone visiting them. So we're preparing for this, and I'm very concerned about it. The president's very concerned about it, but I think we're ready in America, and America just needs to understand this is unprecedented in our history. I hope everyone can leave the politics alone and come together. More people, Shannon, will die from this than died on 9/11. And as tragic of a day as that was, this is a much bigger issue. And I'm proud of the way Americans are coming together and the way our Texans are coming together. And we're going to address it, and we're going to get through some tough times, but we're going to get to the other end, and we're going to lead the world in how to address this issue. And I think the president's done a great job to date.
Johns Hopkins has rated the U.S. as the best prepared for a pandemic, and I do think people will rally together and stick to these precautions. May be disappointing, but very important, and I think people get that. Texas Lieutenant Governor Dan Patrick, thank you for being on with us tonight.
Thank you, Shannon. Yes, ma'am.
Okay.
Thank you.